Hello, I'm Peter Ndora. Welcome to this week's edition of Health Talk. Now, whilst August is National Women's Month, it's also Child Health Month as well. And so today, Health Talk will be celebrating and creating awareness by focusing on women and children's health for the month of August. So what's coming up on the program? Well, we'll be joined by the CEO and founder of PinkDrive to talk about the challenges faced by rural women for early diagnosis and treatment for issues such as breast cancer and cervical cancer, and the impact that it's been having during COVID-19. We'll also speak to the head of the Centre for Vaccines and Immunology at the National Institute for Communicable Diseases about polio vaccinations during the COVID-19 pandemic. And a little later in the program, we'll be talking once again to our general practitioner who joins us to give us advice to COVID-19 patients that resorted to social media to share their frustrations about COVID-19 and also get some answers to some questions about how to treat coronavirus symptoms at home. But first, let's catch up with Zama Buthelezi, who'll take us through the latest South African COVID-19 numbers. So very good morning to you, Zama, and what are those numbers saying?
A very good morning to you, Peter, and our Health Talk viewers. COVID numbers continue to rise in South Africa, and South Africa is now number 5 in the world when it comes to COVID-19 infections. Let's take a look at the national COVID-19 statistics. More than 3.3 million tests have been processed so far in South Africa. More than 570,000 people have since tested positive in South Africa. More than 430,000 people have recovered from the virus, but sadly, more than 11,200 people have since passed on because of the virus. As the country prepares for the peak of the COVID numbers, they continue to rise. 4 provinces with the big metros continue to report the highest numbers of infection. Gauteng, the epicenter of this pandemic, is still leading. Let's take a look at these numbers. As of the 13th of August 2020, more than 190,000 people have tested positive in Gauteng, which is the epicenter of this pandemic. The province recently recording the second highest numbers of deaths at more than 2,700. KwaZulu-Natal is now the second in the country with the rate of infections, recording more than 102,000 positive cases, overtaking the Western Cape province, which was the epicenter for a long time. This province recently recording the lowest deaths among the top 4 with more than 1,500 deaths. Once the epicenter for the long time, the Western Cape is now number 3 in the country, recording more than 100,000 positive cases so far, but the highest numbers of deaths at more than 3,500. At number 4 is the Eastern Cape, recording more than 83,000 positive cases, this province recording the third highest numbers of deaths at more than 2,400. The Gauteng government is to unleash law enforcement officers in Soweto to help with the adherence of lockdown rules due to the alarming number of cases that keep rising in the country's biggest township. Let's listen to the province's Premier David Makhura.
I was told that they are now focusing on Soweto. When we say Soweto, it's at the moment the sub-district that has got the largest number of confirmed cases is Soweto. That's where we are going to direct lots of interventions in those areas, including law enforcement of funerals, ensure there are no parties, there are no public gatherings, but also mobilize communities in those areas to come to the party on the social measures, to also ensure the communities know their own areas, which sections of Soweto has got new cases. They need to know so that they can protect themselves.
While it looks like the following provinces are recording the lowest numbers compared to provinces with big metros, the rate of infection is really picking up. Let's look at where they are. More than 30,000 people have tested positive in Free State. More than 22,000 people have tested positive in the Northwest. More than 20,000 people have tested positive in Mpumalanga. More than 11,000 people have tested positive in Limpopo. More than 7,000 people have tested positive in the Northern Cape. Well, according to the World Health Organization, COVID-19 is going to be with us for some time, and the organization says we must learn to live with the pandemic. Let's listen to the organization's Dr. Tedros.
It's sobering to think that 6 months ago, when you recommended that I declare a public health emergency of international concern, there were less than 100 cases, and to be exact, 98 cases, and no deaths outside China. The pandemic is a once-in-a-century health crisis, the effects of which will be felt for decades to come. Many scientific questions have been resolved. Many remain to be answered. Early results from serology studies are painting a consistent picture. Most of the world's people remain susceptible to this virus, even in areas that have experienced severe outbreaks. Many countries that believed they were past the worst are now grappling with new outbreaks. Some that were less affected in the earliest weeks are now seeing escalating numbers of cases and deaths. And some that had large outbreaks have brought them under control. Although vaccine development is happening at record speed, we must learn to live with this virus, and we must fight it with the tools we have.
As we approach the peak of this pandemic, we remind you to always wear a cloth mask that covers both mouth and nose. Regularly wash your hands with soap and sanitizer. Use sanitizer with 70% alcohol content. You're also required to regularly clean and sanitize all surfaces and always keep a safe distance of at least 2 meters from other people. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your medical health care provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you so much, and back to you, Peter.
Summer, thanks very much indeed. Yeah, we certainly have to keep a track of those figures indeed. All right, so thanks for those statistics, Summer, but do remember that as we observe and report on COVID-19 cases, these numbers can change sometimes significantly, as we've been seeing certainly in the last few weeks. All right, now we've got quite a lot that we'll be looking at during the course of today, but first, the question of the day that we're going to be looking at is this one. Do women in South Africa feel that they have access to proper health care? And you can be part of this show. Remember, you can ask questions of our guests, and some of those questions that you might have in mind just from what you're hearing, you can share with us. And the number to call is Johannesburg 011 714 5861 or Johannesburg 714 5877. And just another reminder of that question of the day. As the country commemorates Women's Month and thousands of women continue to die from preventable cancers daily, our question for you this week is, do women in South Africa feel that they have access to proper health care? You can send us your voice notes and video messages on our WhatsApp number, and that's 065 862 4548, 065 862 4548. Try and keep your messages under 30 seconds. And also you can share your thoughts with us on social media, and you can find us on our Twitter handle at SABC Health Talk, or also on our Facebook page, which is SABC Health Talk. Health Talk continues right after this. Stay with us.
For over years, the SABC has been at the forefront of broadcast radio and television, bringing joy and happiness to the homes of many while continually redefining South Africa's media landscape. We do not speak with one voice. We let every voice in our nation find expression in language and in culture. We do not just bring the news, we provide content that is independent and impartial. We do not just broadcast sport, but we do it for the love of the game. We do not just entertain, we deliver local content, representing Mzansi for sure. We empower you with educational content that reminds you where you belong. With 19 radio stations and 5 TV channels, SABC 1, 2, 3, Education and SABC News Channel, we ensure that everyone in our nation is informed, educated and entertained. All the while knowing that at 84, there's still much more yet to come. Hashtag 84 years of SABC.
Welcome back. You're still watching Health Talk. Now, as the country commemorates Women's Month, women in South Africa, especially in the rural areas, still face challenges in accessing their right to proper health care. Some have had to travel long distances only to be sent back because of the lack of proper equipment to screen and diagnose conditions like cancers, ending up dying instead of getting the immediate attention that could save their lives. NGOs like the PinkDrive are working in the cancer space, have taken it upon themselves to help women, especially in the rural areas. Let's take a look.
One in every 26 South African women is diagnosed with breast cancer. Breast cancer not only touches the lives of women affected, but their loved ones too. The objectives of PinkDrive is to support the women of our country who need help, support and education, because if breast cancer is detected early, the chances of it being beaten are good. PinkDrive work closely with both local and regional government to identify areas where there are no mammography facilities available. Free mammograms are offered to women without medical insurance. The PinkDrive mobile mammography units are a unique concept and a perfect way to educate and connect marginalized women to information and treatment. Specialized educators provide information about breast health, perform physical breast examinations, and screen up to 25 women per day.
We chose this community firstly because we want to prioritize rural communities, but we are also fully aware that rural people are the ones without the necessary services. They are the ones that would not necessarily get the particular services that PinkDrive issues, because one, the nearest hospital is more than 100 kilometers away. So we're making sure we're selecting communities that benefit. We select communities that are rural based, because that is where you get uninsured women. That is where you get women who really need the service.
We will never give up hope. We are here to help all the medically uninsured in South Africa.
The work PinkDrive does is incredible, and I think sometimes we don't sit back to just show gratitude for the kind of work they do. If you think about the number of women in terms of statistics that die every single year in our country because they haven't had a pap smear, here are people who go out of their way to go to the most rural of areas to give the service.
Well, breast cancer is the most common cancer affecting women in South Africa and worldwide. A lack of resources for early diagnosis and prompt treatment for women has seen many of them dying from breast cancer, especially in rural areas. Well, as the country commemorates Women's Month, we speak to Nolene Kochan, who is the CEO and founder of PinkDrive, a health NGO educating and raising awareness and screening citizens without access who reside particularly in areas where health services do not reach for preventable cancers, namely breast, cervical, prostate and testicular cancer. Nolene, thanks very much indeed for joining us. Welcome to the program.
Thank you, Peter, and it's good chatting to your viewers as well.
It must be sad for you, who's been working in this space for such a long time, that so many years later into democracy, there's still many women, particularly in the rural areas, who just don't have access to the kind of healthcare that they need, especially for things like screening for breast cancer and men for testicular cancer and things like that.
Yeah, you're 100% correct, Peter. So, in 2009, I recognized the need for increased awareness and cancer screening in South Africa for South Africa's indigenous communities. And it was then that with other like-minded professionals, we established PinkDrive on the premise that early detection will help prolong a life. PinkDrive's cardinal purpose is to contribute meaningfully towards preventing as many people as it can from succumbing to breast, cervical, prostate, and testicular cancer. Our primary focus is on citizens without access to reasonable care for these conditions and who reside in areas where health services do not reach. We recognize that treatable cancers receiving even the basic levels of care could translate into varying lengths of extended life for the afflicted when detected and treated early. We believe that we've got the smart solution to bridge the gap between private and public health care by delivering a complete women's health care service in South Africa. And what's that solution? Mobile health units. We are all about reach. And our mission mirrors that of the National Department of Health to prolong lives through the prevention of illness, disease, and the promotion of healthy lifestyles, and to consistently improve the healthcare delivery service for those who cannot afford or do not have access to receiving the much needed cancer services.
All right. Nolene, I mean, I think this is a great initiative and one I'm sure has saved thousands of lives already. I'm just wondering, there's the technical things like the mammographs and so on and so forth, the pap smears, but I suppose you could start literally by teaching people how to feel for lumps in their breasts. Is that something that is happening enough in the rural areas, do you think?
It's definitely improving. I mean, we aren't the only cancer NGO that is doing education. We are the only one that does mammograms in sub-Saharan Africa for the medically uninsured. But education, like anything, is key and vital. It doesn't matter whether you're educating on breast cancer or you're educating in schools. And it's for this reason that PinkDrive has a very active schools program, obviously, sadly, because of COVID. The kids are not back at school and we can't deliver our services. But I mean, we start our cancer education literally from grade 1, and there's a program that's for the little ones. It's all done with puppets. It's in the vernacular, so from grade 1 to grade 7, and then we've got a high school program. We take that into the communities, into the colleges, universities, etc., because education is vital. And when we are out there, not only do we deliver the mammograms, the pap smears for cervical cancer, the PSA screening for prostate, and the education on testicular, we make sure that we also educate the community nurses and the health workers, etc., because sadly, some of them don't even have the skills and the knowledge, as to what you must be looking for and explaining to these women and men, because we mustn't forget that men get breast cancer as well. When they come to the clinics, what they should be looking for. So, we have 4 principal interventions through our flagship programs, and that's obviously showing people how to do a clinical breast examination properly. There's the mammograms for the detection of cancer. And I think what's also important to note is that not all lumps are necessarily cancer. And then of course there's pap smears for the cervical cancer. We're very blessed that we have one of the big laboratories who has partnered with us. So the results we are able to get back to the clinic or the individual as soon as possible, because there's such a backlog at the National Health Laboratories. And sometimes a woman has to wait 6 months, 9 months to get her results back. I mean, in that time, she's definitely another stage. And in quite a few instances, she's probably passed away from a disease, which, if detected early, is curable. Mm-hmm. And then not forgetting the prostate and testicular cancer for the men. So those are the 4 cancers that we focus on. However, we do collaborate with other cancer organizations. And when we are out there, we invite everyone to come along with us. Chocker's joined us on numerous occasions, the Sunflower Foundation, because once again, they can help us educate the communities on what other cancers are available.
All right. I guess the other thing in terms of education is taking out the fear. Once you hear the word cancer, people think I'm going to die. But as you're saying, early detection can save a lot of lives. And also there is treatment, isn't there?
Absolutely, but unfortunately the treatment is far away from the sort of communities where we are at. And we have a very, very good relationship with the tribal leaders now in communities as well. And it's amazing how they are helping us, try and dispel some of the myths and the stigmas that are attached to the disease. The past week and yesterday and today, we're working in communities in Hammanskraal and Bronkhorstspruit, and it was, for me, it was an absolute eye-opener to see how many people the community and traditional leaders actually mobilized to come through to us, even whilst we addressing another pandemic, which is COVID screening. So what PinkDrive does now, over and above delivering our cancer screening services, we are working very closely with the Deputy Minister of Social Development, and she has mobilized that National Health Department provide us with nurses to assist us in doing COVID testing and screening at the same time. Because, sadly, with COVID, a lot of our services came to a grinding halt in March. And, when one looks at some of this, the numbers that are out there, it is stated that, 105,000 people are diagnosed with cancer in South Africa every year. Yet, it's also estimated that due to the lockdown, a third of these people are not receiving the cancer services that they should. So, if a third, or let's say 35,000 people are not picked up through screening and referred for treatment, the cost of COVID is without a doubt going to be far greater than the number of people who die from it. And, what we are seeing is the decline of the number of new patients that are being diagnosed. And this is a direct result of COVID.
My goodness. Nolene, sadly, we're going to have to leave it there. We've run out of time, but thanks so much indeed for the great work that you are doing through PinkDrive and working with so many people to make sure that the people vulnerable in the rural areas are getting the help that they need. Thank you so much for talking to us this morning.
Thank you, Peter. And in closing, Nkosi Sikeleli Africa, hashtag stay home and stay safe.
Wonderful. Thank you so much indeed. That was Nolene Koshan, who's the CEO and founder of PinkDrive, talking to us about helping the vulnerable in the rural areas, particularly when it comes to those various types of cancers, breast, cervical and testicular. Now, as the country commemorates Women's Month and thousands of women continue to die from preventable cancers daily, our question for you this week is, do women in South Africa feel that they have access to proper health care? You can send us your voice notes or video call us on +27 65 862 4548. You can also share your thoughts with us on social media, and our Twitter handle is @SABC Health Talk. Now, after the break, we listen to a package about South African polio survivors from the National Institute for Communicable Diseases. Stay with us.
We live in a new high-tech environment. Because of technology, some of the world's wealthiest people are tech entrepreneurs. Tech is how we play and how we work. For your tech conversation, join me, Phumelele Zondi, on Network every Sunday at 8:30 p.m.
You're watching Health Talk, and we're going to take a focus now on polio. And often, multiple children in the same household would die of polio, with survivors left in wheelchairs. Now, South Africa still has polio cases, had polio cases well into the 80s, with the last case of wild polio virus in 1989. These survivors tell us why it wasn't easy to eradicate polio back then.
I was born with no polio. I was born like any other kids, and at the age of 2, when I was starting to walk, about that, I think that I walked, and then after that, according to them, there was an outbreak, polio outbreak, I think in 1970. Because I was born in 1968. So in that outbreak, and it affected me, and it also affected my father. According to my parents, they say I was admitted at the same time with my father. For my father, because he was old enough, I think he managed to not to be affected as me. For me, that they have to do the operation, of which it make it worse rather than solving the problem.
One of the days I had just a chat, a casual chat with my late mom to try and understand as to what actually led to this. It wasn't easy for her to actually share with me, but she had to tell me the truth. You see, it's said that I could not get the immunization for polio because my mom did not have 5 rand. Now you see how hard it was back then. Just to get 5 rand to transport a child to a clinic, just to get an injection. So now that 5 rand led to all of this. I couldn't get immunization.
I don't remember much when I was actually admitted with polio, but I know for a fact from what I was told that I was absolutely totally paralyzed. So maybe that's also a reason why I don't have much memory of it. I do recall when the nurse and the doctor entered the room and tried to make me walk. Initially I couldn't. The days I actually started giving my first steps towards the doctor was the day I started my recovery. In total, I spent about a year in that hospital.
After having lived in the unfamiliar impairments for decades, polio survivors discovered that, at their dismay, their bodies were failing them once again. Many began to experience new pain, fatigue, and muscle weaknesses, and that is called
post-polio, which emerges when you're about, depending on when you got it, about 40 years later, where suddenly you have loss of function. You have breathing problems, swallowing problems. Not everybody, but some people have really a worsening of their symptoms. I have experienced suddenly a loss of function, which has been quite a shock to me.
Very heartbreaking stories that, a preventable disease such as polio has affected so many people. But times have changed, but we still have to remain vigilant. But we're also looking at breast cancer, particularly during Women's Month. And as the country is commemorating Women's Month and thousands of women continue to die from preventable cancers daily, our question for you this week is, do you think that women in South Africa are getting the proper access to healthcare that they need? Send us your voice notes or video calls to our WhatsApp number, which is 065 862 4548. 065 862 4548. You can also share your thoughts with us on social media, of course, Twitter at SABC Health Talk, hashtag SABC Health Talk. We'd love to hear from you. Now, after the break, we speak to the head of the Centre for Vaccines and Immunology from the National Institute for Communicable Diseases about polio vaccinations during COVID-19.
Fellow South Africans, the road is calling. Whether you go to Worcester or to work out, to visit Gorko or the game reserve, the question is, can you pay less for driving less? Yes! With Chili from King Price, the less you drive, the less you pay. And paying $2.99 for comprehensive car insurance just makes sense. You've got zero to lose and plenty to save. Chili from King Price. Visit kingprice.co.za or download our app.
With MTN Business Broadband LTE, fast, reliable business internet is as simple as plug and play. Plug in a fixed LTE Wi-Fi router and work anywhere for just $199 per month on a 24-month MTN Business Broadband LTE 30-gig plan. It comes with a total of 60 gigs of data every month to work, conference, share, download, and more. When you need a fast, reliable business connection, we're good together. Sign up or upgrade at an MTN store today. Everywhere you go, MTN.
In the trenches of business, don't lose sight of the bigger picture. With Nedbank systems integration and electronic banking solutions, you can minimize risk, increase efficiencies, and stay on top of your cash flow. To guide your growth, search Nedbank Bigger Picture Business Banking.
In South Africa, the National Institute for Communicable Diseases investigates every child with sudden neurological weakness for polio processing hundreds of samples from South African children annually, despite not having a wild polio case for almost 30 years. Such a situation is unsustainable for more than one disease at a time. Now, to talk to us broadly on this matter, we're now joined by Dr. Melinda Suchard, who's the head for Centres for Vaccines and Immunology at the National Institute for Communicable Diseases. Thanks so much indeed for joining us on the programme. Welcome to you, Dr. Suchard.
Thank you. Good morning.
All right. So is polio still something that we see in South Africa? I know that at one point we were considered polio-free, and then that was taken away in 2017, if I remember correctly.
That's right. The African Regional Certification Commission is a body that scrutinizes how hard every country looks for polio. And in order to meet the polio-free requirements, you need to investigate every child with weakness from many causes, either viral illnesses or whatever the cause may be, with laboratory sampling. And you need to get certain score criteria in order to say that you're looking hard enough for polio. And that year, our statistics had dropped a little bit below what they should have been, and our polio-free status was revoked. And we needed to resubmit documentation to the African Regional Certification Commission in order to prove our polio-free status once again.
All right. So talk to us about polio. I think a lot of us just see in movies people in braces, and that's kind of how it's been sold to us over time through the media. What is polio, and what should we be looking out for, if one is fearful that it could be upon us?
Right, so polio is not gone. There is still polio in a few countries in the world, but nothing compared to what it used to be. Polio used to be in more than 150 countries in the world in 1988, which is when the Global Polio Eradication Initiative was launched. And now there are only a handful of countries remaining with wild polio. The symptoms of polio are an acute weakness, sometimes following a mild viral illness. So patients get a flu-like illness and a few days later present with a sudden onset of paralysis in what was a previously healthy patient. So, for example, one arm might become paralyzed, or one leg might become paralyzed, or very weak and unable to function. And if the breathing muscles become paralyzed, then polio can lead to death because patients are then unable to breathe.
All right. I know we're vaccinating children against polio. Is it ever too late to get vaccinated? Just in case you missed it as a child, can you get a vaccination as an adult?
It's never too late to be vaccinated. Although you would probably need to be caught up in private sector. The clinics may not be familiar with vaccinating adults, but it's never too late to be caught up. Currently, we vaccinate children up until the age of 18 months for polio. So a reminder that it's very important to get the later vaccines in the schedule, not just the vaccines when a child is very young at 6 weeks of age and 10 weeks and 14 weeks. But parents must be reminded to take their children particularly for the vaccinations up until age 18 months, and again for booster doses before primary school and before high school of other vaccines. And I think people are perhaps a bit afraid during COVID times to seek healthcare. And just a reminder to people that unlike COVID, which spares young children, vaccine-preventable diseases like polio and measles particularly attack young children and are particularly severe for them. And it's very important to keep our healthcare and our vaccination cards up to date.
Have you seen a drop in the number of children that are being vaccinated against polio during COVID-19?
Yes, the numbers did drop, particularly during the hard lockdown at the beginning, and they are starting to pick up again. But we do think that a lot of children have been missed or have missed their scheduled appointments during the time between March until now. And for those children, it's not too late to catch up. they should return to the clinic and ask their nursing sister to make sure they've had all the doses of the required vaccinations.
And also, just for reassurance, the immunisation clinics, they're all set up for safe immunisation, aren't they?
Yes, they are set up for safe immunisation. They are paying attention to social distancing and to really making the experience as safe for people who attend the clinic as possible.
How is polio transmitted? Is it highly infectious?
Yes, polio is spread through the fecal-oral route mainly, which means from contaminated food or water sources that have been contaminated with fecal matter. But it can also be spread through respiratory spread.
All right. So how well are we doing? You talked about, our strength in terms of looking for polio. How well are we doing in 2020?
I think there have been some strengthenings and improvements in the health systems, both in the vaccine delivery side as well as in the surveillance side in terms of investigating cases with neurological weakness. But COVID has put an interruption into many health programs and many health systems. And I think it remains to be seen how strongly we emerge from the COVID crisis in terms of our routine healthcare delivery.
And I would imagine one's always concerned about people in remote areas, rural areas, about vaccines and also trying to find them. Hello, Melinda, are you still there? Hello, Melinda, can you hear me?
I'm sorry, I didn't hear that whole question.
I was just saying.
But yes.
Yeah, I was just saying that I would imagine that the rural areas, remote areas, people living there continue to be vulnerable, and extra work and care needs to happen to make sure that the vaccines get there, and also that you look for it in places perhaps we don't even know are out there.
That's right. An outbreak can happen anywhere. We've seen that vaccine-preventable diseases for which we have good, strong, effective vaccines can take more lives than other novel pathogens. For example, in the Ebola outbreak in DRC last year, more children died of measles than died of Ebola. So vaccine-preventable diseases are a real threat to communities everywhere. And it's an absolute, pity and travesty when children die of a disease that is preventable. We've seen the urgency with which people want to develop a COVID-19 vaccine. They're clamoring for it, and there's so much effort going into a COVID-19 vaccine. But a vaccine is only as good as the number of people who reach with that vaccine. It's only as good as the number of people who are vaccinated. And that's what we need to ensure, that for all the diseases that we have vaccines, effective vaccines for, we must ensure every child gets access to those vaccines.
And again, prevention is better than cure. And we actually don't have a cure even now for polio once you get it. Is that correct?
That's correct. It's a viral illness, and we don't have cures for viral illnesses. The treatment is supportive. So we can, correct fluid balances, and we can give physiotherapy to improve the limb tone. And if the breathing muscles are paralyzed, then the patient can be ventilated. You may have seen those historic pictures of people in iron lungs from the 1950s.
Yeah.
Iron lungs were early ventilators that kept patients alive. Even for months and months, patients would lie there in the hospital being ventilated by an iron lung. So even today, there is no cure for polio. There's just symptomatic treatment and keeping patients alive as best we can while we wait for their other muscles in their body to try and recover and take over some function from the damaged muscles.
All right. And perhaps finally, what would be your most important message to our viewers around polio and I suppose vaccination?
I think it's good news to know that we are so close to polio eradication and to see the long journey we have gone over the last few decades in terms of the power of vaccines to get rid of a disease that was so feared and so terrifying. We can all appreciate now, having lived through an outbreak, how terrifying outbreaks of polio must have been. Because in the same way that COVID is terrifying us now, these outbreaks of polio used to sweep across the country, and people used to be terrified and stay in their houses. But they knew, in fact, that polio attacked their children, not just patients with risk factors or the elderly, but otherwise healthy children. And I think just putting ourselves in the shoes of people living through those times, we can better appreciate how terrifying it must have been. And I think it's time to reflect and sit back and appreciate the benefits that we've gained through vaccination, and perhaps realize that we shouldn't be very complacent, as diseases become less common. So people are more lazy to go for the vaccines because the threat of that disease is not so real. And I think it's opportune in times of an outbreak for which we wish we had a vaccine to really appreciate the benefits that have been wrought over the last few decades through vaccines against polio and measles and all the other childhood conditions against which we have effective vaccines.
All right, Dr. Sushant, that's where we're going to leave it. Thank you so much indeed for giving us your time and sharing this very important information. Thanks so much.
Thank you.
All right, that was Dr. Melinda Sushant, who's the head for the Centre of Vaccines and Immunology at the National Institute for Communicable Diseases. COVID-19 is with us, but vaccines, you must still go. Very, very important. And polio is one that we have to keep on top of. So please, if you're a parent, take your children, make sure that they get their vaccines. And it's not too late if you've missed some to go and catch up. After the break, we speak to a general practitioner. He joins us to give us advice on COVID-19 patients, a lot of who've resorted to social media, to share their frustrations about COVID-19 and also to find out ways to treat coronavirus symptoms at home. All of that still to come. Stay with us.
Insurance has paid millions to people where they couldn't beat their car insurance premium. Now they've upped their game, because if they can't beat what you're currently paying, you can go ahead and ask them for 500 Rand. Now, if you've been with the same insurer and been claim-free for 3 years, go ahead and tell them to give you a massive 1,500 Rand! Savings or cash, you always get something out. SMS card to 44211 or call 08600 60,000 for a quote.
Igama lami ndingusindiswa. Igama leproject yethu Phaphama Community Project. Siye sikuthathele ipilisi. Senze sure uba uyasela. Umehluko mkhulu ngoba amaxhawazana lisaguli lo mhlobo. Iveka umhlobo wenene kuba project register kanjani. Ba besingamameli iradio besingazi kwanto sihlela apha ezilalini. So umhlobo wenene sincede kakhulu. Ndifuna ukukaba kwa SABC uthe inkosi kakhulu siyalibulela elithuba.
The special rapporteur on the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Congratulations on your appointment.
It's fantastic, I think, to be entrusted and given the responsibility of such a big mandate is something that I don't take lightly. The biggest role as a special rapporteur on health is to advise the UN on the global trends that are emerging. So that work continues.
Right, welcome back. You're watching Health Talk, and we've been inviting you, of course, to share your thoughts with us via social media, and also call us to just get a question through, or perhaps just share your thoughts with us. And I think we have some messages on social media, and let's start with Twitter. And this is a message that's come up from Ruben, who says, "Eish, health is expensive. With no medical aid, not working. It's bad in South Africa. And another message via WhatsApp. I'm Colleen from Venda. As women, we do not have that opportunity because we live in rural areas where our clinics don't have enough materials or test kits that can be used to diagnose the diseases like cervical cancer. And I guess this is why issues like people like PinkDrive are very, very important. We also have a caller on the line. It's Mbali, who's in KZN. Mbali, thanks very much indeed for joining us. What would you like to share with us?
Thank you, Peter. Thank you for this opportunity. How are you?
I'm good. I hope you are too, and staying safe.
Yes, I can say God has been great.
So what are your thoughts?
Okay, I tested positive a week ago for COVID-19, and I'm a pregnant woman. I'm at 7 months now. My biggest worry is that the medication that I'm taking isn't it too much for my unborn child. Like, she's not as active as she used to before the testing and before the medication. And also, I worry that should I test positive again just before labor, will I be able to be in contact with her? Will I be able to breastfeed and all those things? It's really, really worrying me.
All right. You know what? I'm going to put that question to our doctor. So stay listening on the television, and hopefully you'll get an answer for you just now. Thanks very much for coming through. All right. Okay. Well, let's get to the bottom of some of the issues and concerns that you have. The world, as you know, has been waiting for a vaccine. Russia says that they have one, but we'll have to wait and see its efficacy. And there's still no cure, as we know at this stage, for this virus. And those affected are self-isolating, continue to suffer from different symptoms and viruses. Chest pains, painful joints, sore throats are among some of the top symptoms that COVID patients seem to be dealing with at home and struggling with. And having no access to healthcare, thousands of patients have resorted to social media to share their frustrations and their thoughts, and also to get medical advice. And sadly, some of it coming from unqualified sources. Our GP, Dr. Mweketsi Mate, joins us now to take us through some of these questions. Dr. Mate, thanks for joining us. I'm not sure if you heard the caller just before we came to you. What's your advice to her?
Thank you, Peter. I think she must take comfort in the knowledge that once you've had COVID-19, at this point, it looks like you will have ongoing protection from it. There are some suggestions that perhaps 3 or 4 months after being infected, one can get reinfected, but it's only been a very few cases where that's been seen. I think in terms of the medication we use, most of the time we're really using high doses of multivitamins, in essence. Basically things that help to boost the immune system, clean up free radicals. And most of those, in fact, all of them should not have any effect on the growing fetus. So in terms of the treatment, I don't think she should worry about the effects of the baby. Once the baby is born, if mom were to get reinfected again, it's not too much of a concern. She just needs to make sure she doesn't infect the child. And the best way to do that is that when she's handling the child, she must put on a mask, be fastidious with keeping her hands clean, and she'll still be able to breastfeed. So once she overcomes the current infection, she'll be okay.
Well, that's fantastic. That's great news. All right, let's get some other questions that have come through. And let's see the first one that's come through. Okay, this one from Londiwe, who says, I tested on the 8th of July, but the dry cough just won't go away. The throat feels like it has an infection at times. It's itchy, dry, or just uncomfortable. I'm even suspecting that I'm reinfected. I still steam, not every single day though. Today I woke up sweating and with mild lower back ache. Should I test again? I'm scared to go home to see my parents. Okay, so they tested positive and it looks as if this symptoms just are not going away. Do they take time sometimes?
So some of the symptoms of COVID-19 we know can take up to 6 months to resolve. For example, the lack of sense of smell, the shortness of breath, even the dry cough. that can take a while to clear. It doesn't mean to say the person is still infected or is infectious. It just simply means that the after effects. You must also remember, once you've recovered from COVID-19, you have a constitutional right to pick up any other infection. So you may have a COVID-19 and now it's tonsillitis or pharyngitis from other bugs. So I think if the viewer is still feeling unwell, she needs to go back to the doctor, let the doctor have another look. It's unlikely, as I said, to be COVID-19 again. It may be something else, or it could still be the remnant of the infection.
All right, and then we've got a question from Tobile who says, how do I get rid of the rash on my face that's been caused by this virus? Is a face rash one of the symptoms that you can get from COVID-19?
Not that I'm aware of, Peter, but that said, we're learning new things all the time. I think I would advise the viewer to first go see a doctor. The rash may not be related to COVID-19. It may be something else. It may be allergy. It may be that it will be allergy to whatever treatment they were taking. So it's best to go and see the doctor. I think it's unlikely to be the virus itself.
All right. I don't know if we've got any more questions. All right. In fact, I think we do. We have one last one from Londiwe who says, I'm on day 15 and I think my motor skills have been affected. I'm falling from my bed. My muscles from lower back to feet feel like they've been locked. Guinea vertigo. What can help? That's Londiwe asking us. Your thoughts on that?
Again, vertigo is not a common presentation of coronavirus. The vertigo could be caused either by an ear problem or it could be caused by what's called joint position sense problem. I would advise the patient to go see a doctor. They need to have a look at the ears, look at the back of the throat. It may be that she's got an infection in the ears, or it may be that there's something called the Eustachian tube that runs from the ear to the throat. If that's blocked, it can cause vertigo. So she would need to have her ears checked out.
All right. So generally what you've been saying today is COVID-19 symptoms can last for quite a while, depending on which ones you got, how severe they are. And also it's unlikely that you'll get reinfected, but you'll build up some immunity, certainly for a period of time. But anything that you see that is of concern, get medical advice because it might not be COVID-related.
I think you've summed it up nicely, Peter, yes.
Fantastic. Dr. Mate, thanks very much indeed. And we look forward to seeing you again soon.
Pleasure, Peter.
All right. Okay, so that's how we come to the end of the show. Thanks very much indeed to our guests. And for you, for watching Health Talk this week, don't forget the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands, sanitize them, and wear masks outdoors. I'm Peter Ndoro. See you next week. Bye-bye.
De Doorns was 'n rustige area.